Now let's review the other psychotic disorders that we find in this chapter. A 35-year-old female Chinese immigrant is brought in by neighbors after she was found wandering in the streets yelling out someone's name. She appears disheveled and grossly disorganized. You learn that she arrived in the U.S. several days ago and upon her arrival witnessed the death of her 3-year-old son. While in the waiting room, she appears to be responding to internal stimuli. What is essential in this case is that you have an acute situation. This is a patient who becomes psychotic in less than 1 month. And those are the features that you find in patients who have brief psychotic disorder. They can exhibit hallucinations. They can exhibit delusions. They do have psychomotor disturbances. They do have disorganized speech. But what differentiates them from schizophrenia is the duration of the symptoms. Here, the symptoms must occur after 1 day, but less than 30 days. And that is the specific criteria for brief psychotic disorder. It's seen more commonly in patients who come from a low SES or who have some sort of psychological problems such as personality disorders. It's also seen a lot of in patients who have experienced a stressor. This woman in this question witnessed the death of her son. That stressor is the one that precipitated the brief psychotic disorder. You want to make sure these patients are safe, so if hospitalization is necessary, that's what you do. And you're going to give her at least a short course of antipsychotic or benzodiazepine treatment anywhere from 1 to 3 months. And most of these patients will get better. Their symptoms will go away. But what happens when their symptoms do not go away and their psychotic symptoms continue for more than 1 month? Then you have what's called the schizophreniform disorder. Mrs. Jones is evaluated at a nearby clinic after she was noticed acting inappropriately at work. According to her co-workers, she began to act strangely 3 months ago. She began wearing a hard hat to work, and when asked why, she replied, "I will not let you read my mind." She also believed that others were talking about her and routinely asked them to stop. On several occasions, she had to be escorted out of the room because she started to argue with others whom she believed were controlling her mind. This is a woman who appears to have schizophrenia. The only difference is that she has had these symptoms for approximately 3 months. So therefore, you know that it is not schizophrenia, and you know that it is not brief psychotic. So it has to be schizophreniform. Now, the presenting symptoms of schizophreniform are identical to those of schizophrenia, except the duration of the symptoms. These patients will have hallucinations. They will have delusions. They will have disorganized speech. They will have the disorganized or catatonic behavior. They will have the negative symptoms. They do have the changes in their level of functioning, but the symptoms are more than a month and less than 6. And these patients, just as the patients who have brief psychotic disorder, go back to their level of functioning. So when you have a patient who has brief psychotic, more than 1 day, less than 30 days, you treat them with antipsychotic anywhere from 1 to 3 months. When you have patients who have schizophreniform disorder, you want to make sure that they're not in danger of hurting themselves. You want to make sure that they don't have mood symptoms, and you want to make sure that you treat them with antipsychotics. And the treatment will be for a period of anywhere from 3 to 6 months. What if this patient does not get better? What if 6 months go by and she still continues to have the symptoms? Then we change the diagnoses once again to schizophrenia, and we're going to treat her for a period of more than 6 months. Schizoaffective disorder. A 25-year-old woman is found walking nude in the shopping mall. When asked why, she replies, "I'm making it easy for others to have sex with me since I know they all want me." She states that she heard a voice telling her she was irresistible and that everyone wanted her. When she speaks, she cannot focus on one topic at a time and frequently jumps from one topic to another. Her mood is described as euphoric and her affect labile. This is a disorder where basically for an uninterrupted period you meet criteria for a major depressive disorder, a manic disorder or episode, or a mixed episode. You also will be having symptoms of schizophrenia, but you're going to have delusions or hallucinations for at least 2 weeks in the absence of mood symptoms. So basically what you're looking in schizoaffective disorder is a patient who has symptoms of mood disorder and symptoms of psychotic disorders. As far as the prognosis is concerned, the more mood symptoms you have, the better your prognosis. The more psychotic symptoms you have, the worse the prognosis. So when you compare schizophrenia versus schizoaffective, schizoaffective is better. When you compare schizoaffective to major depression disorder is better because it has all mood symptoms. And the treatment, of course, is to give them either an antidepressant or mood stabilizer to treat their mood symptoms and an antipsychotic to treat the psychotic symptoms. Mr. Smith has been married for 10 years, and during most of these years, he believes his wife was trying to poison him to get his money. He frequently complains of stomach pains, which he believes are due to the poison in the food. His thoughts are logical and coherent. He denies hallucinations. His wife, an independently wealthy woman, does not understand her husband's logic since she has more money than he does. Mr. Smith has delusions which are believable. It is possible for a woman to want to kill her husband. It is possible that she might want his money, and it doesn't matter how much money she's got. The more money you have, the more money you want. So is this something that's possible and believable? Yes. So the answer is delusional disorder. And for you to have that diagnosis, you must have the delusions for more than 1 month. They must be believable. And of course, you have no hallucinations. And the symptoms are not affecting your level of functioning. So you do well in society. And there are various types of delusional disorder. The erotomanic, the jealous, the grandiose, the somatic, the mixed, and the unspecified. And the treatment of choice for these patients, of course, will be with the antipsychotic medications. Most of these patients are about 40 years of age. You see this more in women who are married, and women who are employed. It's also seen in individuals who have come from a low SES, and there are times when medical disorders, specifically disorders in the basal ganglia, can mimic this. These patients rarely need to be hospitalized, and antipsychotic medication will be the treatment, even though it is very difficult to treat. Individual psychotherapy will also be recommended to make sure that these people address their delusions and are slowly confronting into what is real and what is not real. Let's review some questions from this chapter. Number 1. A 23-year-old woman was seen today after she complained that her neighbors were talking about her. According to the neighbors, her behavior started 3 weeks ago after she was involved in a car accident. Since then, she's always been following the neighbors for days and harassing them at work. She believes that the neighbors are putting poison in her food and want to kill her. When asked why, she is unable to give a clear explanation, but insists that what she is saying is true. She states that the voice in her head told her it's true and you should stop asking questions. While in the waiting room, you observed her to be dressed bizarrely and laughing inappropriately. What is most indicated in the management of this patient? A. Haloperidol. B. Clozapine. C. Lorazepam. D. Risperidone. E. Flufenazine. Given that she has psychotic symptoms, the treatment of choice will always be the atypical antipsychotic. Since clozapine is an atypical but it's never used first line, the answer of choice will be D. Risperidone. Number 2. If her symptoms do not improve within the next week, which of the following is she at risk for developing? Schizophrenia paranoid type, schizoaffective disorder, schizophreniform disorder, schizotypal personality disorder, or E. delusional disorder. Let's look back at the case and find out how long she has been acting like this. If you look at the case again, you notice that the neighbors stated that her behavior started 3 weeks ago. So given that time frame, you must understand that what she has right now is brief psychotic disorder. Should she continue to have symptoms for more than 1 week, then what is it that she will develop? Then she will develop schizophreniform disorder, which means that she will have the symptoms for more than 1 month, but less than 6. And that would make it letter C.